All right, as it is already 6:05, I would like to welcome everyone to this month's Metamorphosis event, Trans Communities and Reproductive Justice. We've all worked very hard to be able to prepare this event for all of you, and we're so excited to be able to have all of you being able to learn and take part in so much of what this event has to offer. So to start this off, we're going to be going over the Zoom norms for the event. So I will note, by default, all of you will be muted, but we do encourage you to be able to participate. If you would like to speak, be sure to utilize the raise your hand function, which can be found next to your name on Zoom, and also utilize the chat box. Many of us may ask questions throughout our presentation, and we do welcome you to be able to participate to the extent that you feel comfortable. And also, if you feel comfortable with this specifically, be sure to rename yourself within Zoom to also include your pronouns. We want to be able to create a space of which everyone feels as if they are affirmed, because we respect each and every one of your identities.
That's me. So tendremos traducción del inglés al español. Aquí están las instrucciones para tratar de tener interpretación. Entonces se le va a dar clic donde dice Interpretation para comenzar. Y cuando le va a dar ahí, puede escuchar el canal en español. Si tienen problemas con conectarse a la interpretación, por favor, escriba algo en el chat y lo podemos dirigir.
Yes, and one of the other things that we really wanted to be able to note as well is that this event will be recorded. If you don't feel comfortable, be sure to turn your camera off, so that way within the recording itself, you won't be included in anything that pops up. But this is specifically to be able to archive the event and also being able to share it with those who would be able to look through it again later. All right, so as we keep going with this presentation, I first want to be able to introduce QLatinX's work as a whole. So QLatinX is a racial, social, and gender justice organization dedicated to the advancement and empowerment of Orlando and Central Florida's LGBTQ+ Latinx community. QLatinX specifically started in the aftermath of the Pulse tragedy and brought together numerous members of the community who were directly impacted and wanted to create a space of healing and support. And through that, QLatinX has sought to empower the most marginalized members of our community and being able to establish these healing spaces, but also being able to build a community that is strong and united, so that way we could work towards creating for a society that is free of fear, violence, and hate. And one of the many ways that we are doing this is through our new Metamorphosis initiative. So I would say 2 months ago, we had our Trans Justice Program launch. And in the program launch, we revealed what it is that this initiative was, which is this program, Metamorphosis. This presentation is part of a monthly series of which every month there will be a new topic. And we'll be able to actually cover all the various different ways that trans issues intersect with so much of what goes on in our movement. And Metamorphosis aims specifically to establish this communal support network for trans, non-binary, and gender non-conforming youth, and doing so and talking a lot about like political issues that have been going on, and even being able to incorporate some artistic elements in doing so. So we gather monthly, and we really want to be able to highlight the fact that all socioeconomic and political matters intertwine with the trans experience. And we're very apologetic about a lot of the work that we do, because we really want to be able to show just how much our community is important to everything going on. All right, so we're going to be able to introduce ourselves as hosts. You've already heard me speak, but I am the facilitator for the Metamorphosis program and also the gender justice organizer for QLatinX. I go by both she, her, and they, them pronouns. I don't know if Lisa wants to go next.
Hi, I'm Lisa Hernandez. I go by she, her, ella pronouns. I am the Reproductive Health Rights Associate for an organization, but today I am here as a reproductive justice advocate. So not here with an organizational role, just someone that's going to talk about reproductive justice. And Otelia?
Yeah. Hi, my name is Otelia Jumapao. I'm the Gender Justice Intern for QLANX.
All right, well, I'm gonna learn how to unmute myself in a timely manner soon, so we'll see when that happens. But as I said, today we'll be talking mostly about reproductive justice, but I wanna mention kind of the foundations of reproductive and like the different layers of reproductive work, because there's reproductive health, rights, and justice, so we wanna be able to ground ourselves in what the differences between those are, how they work together, etc. This is a really exciting meeting for me because Josa and I particularly have done reproductive health and rights work and have unknowingly kind of intertwined a lot of these different movements, mainly when we were just starting out in the repro field and kind of organizing as you're learning, even though we're all still learning, but we were in very early learning stages. So I'm glad that we're gonna get to revisit that. So if we can go to the next slide. So reproductive health focuses on service delivery. These are the clinics and health centers such as Planned Parenthood, Women's Choice. And then when we talk about reproductive rights, that focuses more on the legality of reproductive health. So that would be like NARAL, Planned Parenthood, and those kind of organizations that are all over the news and actually frequent a lot of attacks because they're the biggest organizations around. Then there's reproductive justice. Reproductive justice focuses on access rather than anything on the legal field. So it is about movement building, it is about the intersectionality of different struggles that people have in gaining access to reproductive health. But we're going to talk a little bit more about reproductive justice now. So we'll start off with the definition of reproductive justice, as Sister Song very clearly puts it, is reproductive justice is the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. Okay, we can go to the next slide. So to talk about the foundation of the term and movement was started by a group of Black women in
But I kind of need to read.
I'm sorry, what was that? Oh, I think someone just forgot to unmute themselves, so I'll just keep going. And for the interpreters, I know I'm talking really fast, so I'm gonna try to slow it down. Sorry. So the term was started by a group of Black women in June 1994, basically before attending this international conference on population and development. These group of Black women met in Chicago, and they started talking about how the reproductive health and rights movement has been centering middle class and wealthy white women. And they decided that these women could not meet the needs of women of color or the marginalized women and trans people. So that's how this term came to be. And then 3 years later in 1997, Sister Song was formed, which is the first reproductive justice organization. And it's still around today in Atlanta. So you can all check out their work. Okay, so let's go to the next slide. So reproductive justice organizes along racial justice, immigration justice, climate justice, criminal justice, queer justice, trans justice, and other movements that center marginalized communities. Because it recognizes that there is, oh, the Sister Songs website, good. It recognizes that international and intersectional struggles, because as Audre Lorde said, we do not live single issue lives. People have different oppressions that play into their choices, into the reproductive choices. So this was based on the human rights framework, and I'm going to read the definition of a human rights framework just so that we know the foundation of that. So the human rights framework is a comprehensive body of law that details the rights of individuals and the responsibilities of government to protect those rights. So very comprehensive, hence why it is intertwined with so many other movements, because they recognize that reproductive health and rights organizations were often very standalone movements, kind of organizing outside of, and excuse my noises, kind of outside of all of these other very important social justice movements. You can go to the next slide. All right, so we're gonna take an example. We're living in a COVID-19 time. It is very hectic. We all wake up and there's another system that has utterly failed us. Systems have been failing for a long time, but obviously this put a magnifying glass on all of this. So we'll be talking a little bit about some of the current issues that people are facing. And when I say some, I really mean some, because there's so many things going on that it would be a really, really, really long webinar to cover all of it. But enjoy my little, whatever I made molecule, atom. I am not a scientist, so we can go to the next slide. All right, so these are some of the barriers that we have seen to reproductive health during COVID. So before this pandemic, health insurance has already been a problem. We've heard about it for a really long time. That's why people were fighting for keeping our access to ACA. People were fighting for Medicare for all. It's been a conversation that we've been having as a whole country for a long time. So before the pandemic, 30 million people were uninsured, and then more than 6 million people have lost insurance since the start. And I say pandemic awareness, actually, just because we don't know how long we don't know how long COVID has been going on for here, but before we were aware of it and actively quarantining, 30 million people did not have insurance. And now that number has gone to 36 million people. It's estimated that way more people are going to lose insurance due to job losses and even spouses losing their jobs as well. So during the lockdowns, we also saw that some states labeled abortion as non-essential. That caused for clinics in Texas to actually have halted procedures, people moving from state to state to try to obtain the care that they need, and people within the state of Texas even having later term abortions later on. And there was just like an increase of those types of abortions, which are safe, but it also creates more of a financial burden on the people that need to get access to those abortions. We also saw that Florida's new forced parental consent bill became a law, which caused some judicial bypass process complications because everything is confusing, as is when you're trying to navigate a judicial system. But when you're trying to navigate a judicial system during a pandemic, that makes it a lot more complicated. There are some organizations that have actively been working to make that less complicated, and we'll be sharing information about that later on. But then hospitals were also adding birthing restrictions, and birthing restrictions are still something that is happening, but of course in the beginning and sometimes even now, it is affecting people's access to doulas and necessary advocates to be with them when they are giving birth. People with insurance can also have their reproductive health care access restricted by their employer for religious reasons, and that was upheld by the Supreme Court recently. So don't go to Hobby Lobby, they suck. But another issue that we saw was that the switch to telemedicine has worsened for Black people's disparities. So the Black maternal mortality rate has been an ongoing issue. We have it even here in Orlando when we see a large disparity in mortality rates here affecting the Black community. And because of the switch to telemedicine, Black women saw that their needs were not being met because their pain was not being listened to when it's done not even face to face. So the rates are getting worse. These are all really terrible things because we are living in a very even more terrible society than we were before, unfortunately. So let's go to the next slide. And I do want to add a content warning. I'm going to be discussing racism and eugenics. So we can go to the next slide. Right, so a current attack to bodily autonomy, the ICE concentration camps. So Irwin County Detention Center, for those who have not heard, this is in Georgia, has been performing mass hysterectomies. This is a continuation of the United States' long history of eugenics, genocide via reproductive oppression. We have seen it in Puerto Rico, we have seen it all kinds of times within this country, in California, we've seen it in Mississippi. So this is not anything new. This is a continuation of eugenic idealism in medicine. And it is really not okay. It is very horrific physical, emotional, and medical abuse that has been going on in ICE facilities as well for a while, that people have been ringing the alarm about it for a while as well. So that is something else that is being faced right now. Can we go to the next slide? So another attack to bodily autonomy. Before the pandemic, nearly half of the US renting households spent more than a third of their income on rent. Housing was already in crisis in Orlando before the pandemic, with people still suffering the consequences from the 2008 financial crisis. And then eviction moratoriums have helped stop some evictions, but not all, and there are around 29 million people at risk of being evicted by the end of 2020. Now, this is a reproductive justice issue because when you literally don't have a home to care for the children that you may have, when you don't have a home to care for yourself, it becomes an issue because you are not really exercising bodily autonomy. You don't really have power to make a complete choice about your body when you don't have a safe environment to be in. And one of to make this more Orlando-based, I don't know if everyone on here is from Orlando, but that is mainly where Q Latinx is, and that is where I am. We do have a lot of issues with housing here. Even the Star Motel, which Orlando DSA has been uplifting that issue a lot recently. But essentially what is happening is that there is a motel in the Orlando Kissimmee Cusp area that has been without water, without light, without electricity for a very long time, and that is during a pandemic in which water is very necessary to keep hygiene going. So that is very unfortunate, but that is why I'm including it in the attacks to bodily autonomy, because when you don't have housing, it is kind of hard to care for your own body. It is hard to make reproductive choices. So let me go to the next slide. And then one of the things I wanted to include, of course, is that we are in the midst of a uprising because of all of the horrible police violence. So state violence on Black bodies is an attack to reproductive justice as well. And to make this connection, one of the Black Lives Matters founders made it very clear that reproductive justice is very much situated within the Black Lives Matter movement. It's not just about the right for women to be able to determine when and how and where they want to start families, but it is also very much about our right to be able to raise families, to be able to raise children, to become adults. And that is being hindered by state violence in many different forms. One form being violence by law enforcement or other state forces, and the other form of crisis through poverty and lack of access to resources and lack of access to healthy communities that are safe and sustainable. Next slide. So reproductive oppression is basically about control. It's about controlling your body, your choices, your environment, your status. It is about white supremacists and capitalist systems seeking to control your autonomy along with your communities via restrictions, laws, attacks, and violence. So one of the ways we had this idea of trying to give you all different ways to combat this white supremacist attack. And one of the ways to do this on a personal and communal level is to care for another, cherish your communities, and cherish your body. And then now I'm going to leave it to Josa to talk a little bit about trans experiences and trans justice within reproductive justice as well.
Thank you so much for that phenomenal foundation of reproductive justice as a whole, Lisa. Before I get on to my part, I want to be able to ask people within the audience if they have any questions they would like to ask Lisa, whether it be if they want to use the raise their hand feature or they want to put it in the chat. I see that Andrea says, great presentation, Lisa. And I'll give just a very short moment to see if anyone else is probably still typing something in. All right, so now we're going to be able to talk about the stakes that trans communities have in this conversation. The portion of which I will be starting on is only the first of which is part of this conversation and will be continued on through Ofelia. And one of the things that I want to be able to note within this conversation is that obviously there's going to be some heavy topics in talking about a lot of different obstacles that trans people face, not only in the healthcare system, but also financially, and just overall thinking about transphobia as a whole and how it manifests itself systemically through a lot of these institutions that we have to navigate. All right, so let's go on to the next slide. So the first thing that we're going to be talking about is just in general the experience of being able to navigate healthcare as a trans person. And many of you may already know that trans individuals unfortunately face heightened stigma when seeking medical care. And some very important data points to be able to mention in this is that 28% of trans and gender diverse individuals report experiencing harassment in medical environments. And 19% report being refused medical care altogether. And it is because of their gender identity, and this becomes more pervasive when we look specifically at this being targeted toward people who belong to communities of color. And this is something very important to note because even with some of the information that I could provide in this presentation, a lot of it can become more pervasive when examining it, not just as the trans community as a whole, but when it's trans people of color specifically. All right, so one of the first things that I really want to be able to illustrate is how there's this long-standing history of gatekeeping, essentially. And there have been medical professionals acting as such, But in this specific scenario, it's the fact that it's been healthcare companies. I tried to kind of put it through this little illustration here with what I imagine is like a healthcare executive blocking the gate to a hospital. And I put that there because I really want to be able to illustrate the fact that health insurance companies do deny trans individuals coverage for services by default. And they kind of explicitly state that it's because, let's say if there was a service that they really needed, and the issue being that a person's sex not matching that of which the service is recommended. And that becomes a very pervasive issue in just the entirety of what we're going to talk about in this presentation, because it's going to lead to some very striking statistics. And one of which is the fact that when you consider these obstacles, this also means that trans individuals either have to pay out of pocket or having to choose between that and going without any medical care. And that's obviously something very concerning, even in the climate that we're in and that we're currently having to navigate a global pandemic. And despite being more likely to have a college education, trans people are 4 times more likely to have a household income under $10,000 per year. And you can only imagine what then everyone has to be able to navigate in these conversations when you're already struggling to afford rent, you're already struggling to put food on the table, and then you also have to think about things that you need medical care for, and how then that becomes an issue when also thinking of preventative care, thinking of reproductive care. And this is really like one of the most striking things, and that's the fact that 48% of trans and gender diverse individuals have reported that they've just postponed care when sick or injured. And 50% of trans and gender diverse individuals report just postponing or avoiding preventative care. And this is something that really puts us in a tough situation, because in thinking of how already the United States has been as like a whole, and how we've already been doing terribly with handling COVID-19. And then just imagining that as we talk about very vulnerable communities, it's also talking about things that have been long-standing even before the pandemic, even before a lot of the conversations that we've been having recently about how we can change the healthcare system and how then we can ensure that everyone has services of which work for them, with obviously the different financial situations that people are in. And when you really think about it, this is very much applicable to when trans people have to seek reproductive care. So in talking about trans reproductive care, there are multiple different examples of which some of the things that I've talked about has like manifested itself. And that's the fact that health insurance companies may also deny coverage to, let's say, a trans feminine person who needs to undergo a prostate exam, or a trans masculine person who needs a mammogram. According to a study, half of trans masculine participants did not receive annual pelvic exams. And obviously this was in part because not only the discomfort with the physical exam, but the difficulty finding a medical provider with whom actually affirm their identity. So when we think about that, a lot of us really have to think to ourselves, how then can we create more affirming institutions? Does it have to be that more trans-specific clinics and places have to be made so that way people feel affirmed? Is it that doctors or medical professionals have to seek out or being offered more training so that way they have a sense of trans competency? What are the various things that we have to look into to ensure that this doesn't become a recurring issue? And those are things I very much want everyone to be able to think about as we go about this. So one thing that I will be talking about specifically in this moment is the topic of fertility preservation. And for a lot of you who may not know this, this is actually one of the most significant reproductive justice issues when speaking about trans communities, because ultimately the issue of fertility preservation is an issue of bodily autonomy. So before I go about this conversation, I do want to give a little bit of a note of caution. And that note of caution is the fact that sometimes when navigating this very important conversations, it's kind of been manipulated in some way by people who themselves are anti-trans, transphobic, or trans misogynists. And one very specific example of this that maybe some of you may be already aware is the existence of people who call themselves trans exclusionary radical feminists. The acronym for them is TERFs. And this has been brought to light recently a lot because of J.K. Rowling, the author of Harry Potter. And she's been going on Twitter a lot, talking basically a lot of points that are TERF points, trans misogynistic ones. And in doing so, she's kind of manipulated some of this conversation and some of the people who follow her as well, in that when fertility preservation is a very important conversation, they've also kind of likened it to quote unquote medical experimentation. And in doing so, they've been kind of creating a narrative that prevents people from actually wanting to medically transition. And that's an issue. When we talk about this, we want to talk about this carefully because we don't want to have to refrain anyone from doing what is part of their journey, what is part of becoming their truest possible self. So I kind of wanted to give that note just as an air of caution, because this is something that is an ongoing discussion, even in popular media, and even by people who manipulate some of this. So in talking about this, one thing that I want to mention is that due to a lack of affirming fertility preservation counseling during the medical transition process, there is a lot of trans and gender diverse people who've unwillingly lost the option of being able to have biological children. And one thing that I want to note is that in talking about fertility preservation, there's also the fact that the cost is extremely expensive. It can go about even to $15,000 depending on the option, and often most options are not covered by insurance for people of trans experience, and the intersection of racial, gender, and class disparities in the US kind of exacerbates like what we're going to eventually talk about being an injustice for Black and brown people of trans experience. But one thing I want to be able to ask to all of you, and this is hopefully a portion of which maybe some of you would feel comfortable raising your hand or putting in the chat, is that when we talk about this, do you see this as a form of just neglect, or do you see it as a form of sterilization? And I say that because we're kind of referring back to already a heavy conversation that we had in talking about like mass hysterectomies in ICE facilities and the history that the United States has had in coerced sterilization. In the chat, or however you want to participate, which do you feel is more likely the case? Gonna give everyone just a short little moment. All right, so, okay, I see someone has already put coerced. Another person saying coerced sterilization, folks should be made fully aware of all their options. And yes, definitely. So let's go on to the next slide. So in one study, 77% of trans men had not considered freezing their eggs at the time of starting hormone replacement therapy. For many of you who don't know what hormone replacement therapy is, it is a form of medically transitioning, and it's one of the most common forms. And despite more than half of them saying that they wanted to have children. So in thinking about this, it's also referring back to the fact that there wasn't a very affirming counseling process in talking about this. And people transitioning on their own by buying hormones outside of the healthcare industry are even less likely to have adequate counseling on potential infertility. And it's definitely an issue of bodily autonomy, because then it kind of gets to a point where then they didn't have that option for themselves to be able to decide in what is something that maybe some would have wanted to be able to have their own children, and then having that option just entirely being removed. And for those of you who argued coerced sterilization, I 100% agree with that. I'm going to see if there's another comment. The medical industrial complex in the US actively has and continues to use sterilization to oppress. Definitely, Lisa definitely mentioned this when talking about like that foundation for reproductive justice and how this has been done in specific states and abroad. So one thing I want to note is that although there is not a blunt requirement at the federal level that trans and gender diverse people undergo sterilization in order to update their legal identification, some states do require sex reassignment surgery. And sex reassignment surgery can be very expensive and very inaccessible for a lot of trans people. And in not being able to have your documents updated, even if that's not the mark, it's not the marker of what makes a person trans. Anyone who says they're trans is trans, period. But in not being able to update legal documentation, what ends up happening is that there's a lot of barriers, a lot of forms of discrimination, and a lot of things that happen that we're going to be able to discuss in the next slide. So in talking about gender markers specifically, being unable to change gender markers on documents exacerbates the health, social, and economic inequities that people of trans experience face. And it does so by putting trans individuals at risk of involuntary disclosure and basically general discrimination during daily encounters. And what I mean by daily encounters is just that. It's even just entering a club or a bar, something that so many of us were able to do before the pandemic, and where a lot of us were able to be our authentic selves within our community and being a part of the clubs that we were a part of. And it's also thinking about when there's a traffic stop and, for example, you may be stopped by a police officer specifically, and then what are the repercussions of then having to deal with that as a trans person, a Black trans person especially, and other things that many of us have had to do, like applying for a credit card, for example. So one question that I want to be able to ask to everyone is, can you come up with more examples of which there can be like these instances of discrimination because of these documents not being updated? Going to the restroom, yes. Applying for a job, definitely follow discrimination in employment. A background check for work, going to the airport, applying for a passport, applying to school, immigration services, yep, travel, renting a car or a hotel room. These are all things that many of us have had to do at some point. Going to a shelter, yes, that is one of the most striking things that we talked about during our last Metamorphosis event, which is when we talked about climate justice. And in talking about climate justice, we talked about specifically in Hurricane Katrina, how a lot of trans people were denied going to shelters and even just facing discriminations when they were there. Definitely when people are incarcerated, a very pervasive issue. I'm actually hoping that we're able to have a meeting specifically about incarceration for like the program, because that is something that is very pervasive. Playing in sports. Yeah, in sports is also, for example, if a teenager plays for their school sports team, another issue is what rules schools have and what does the state have for trans people playing in specific sports. And there's a really good documentary about this called Changing the Game. I'm not exactly sure if it's streaming anywhere, but we once did a screening at Rollins for it, and it's a very informative documentary about just the amount of discrimination that has to do with, one, legal identification, and teenagers being able to play on their sports teams while identifying as trans. All right, going to the next one. All right, so in talking about this, it's also considering insurance restrictions. People have reported not updating health insurance records for fear of obviously losing access to reproductive health care. And so much of the different obstacles at play are provider bias, insurance coverage restrictions, physical discomfort, misinformation can also stop transmasculine people from accessing things like abortion services, pap tests, breast cancer screenings, pregnancy and postnatal care. These are all things that we have to consider along this conversation and how exactly we're going to be able to actually change a lot of this. And let's go to the next slide for the end of my portion. This is going to be continued with Ophelia. And that's the fact that we really have a long way to go. And this, to me, in reading this specific data point, was where I felt was the most concerning. And that's the fact that in a study of obstetrician gynecologists, 80% had no trans-specific healthcare training whatsoever, and only 33% reported feeling comfortable in providing care to transmasculine patients. And this is something that's extremely disheartening and also very tough to even have to read aloud. And in thinking about this conversation, it's how do we move from this and how do we make the reproductive health institutions more affirming of trans people. And we're going to continue this on with Ophelia.
Hello, yes, I'm going to be talking about non-binary reproductive justice. So just to echo what Josa was saying about the ignorance of healthcare providers, in the 2012 National Transgender Discrimination Survey, participants said that 50% of them had to teach their medical providers on how to give transgender and gender diverse care, which is, again, very alarming. And I also included a quote that I thought was very powerful by Mel's, a non-binary UK writer. To have a womb does not mean to be a woman. To be a woman does not mean to have a womb. To suggest either is to violently erase trans people right across the gender spectrum. And Mel's also talks in their article around the fertility preservation and how, this is a very big and important part of our conversation, talk about how, trans people are really not having that ability to become parents and to have children of their own. And that is definitely something in society that needs to be, unpacked and dismantled. Next part is also about the inadequate research. So there's a lack of research on the risks of HPV and cervical cancer. In one Boston study, researchers found that binary transmasculine folks are more likely to have had a pap test compared to their non-binary counterparts. Then again, the study did note that most of their participants were white folks with bachelor degrees and access to private healthcare. And I think that's important, just like what was said before, on how these disparities are very likely to be much wider for communities of color. So again, we have that inadequate research, even for specifically trans, gender diverse people of color. So the study hypothesized that transmasculine folks may face more obstacles to getting a regular pap test compared to non-binary folks because of the barriers of transphobia, lack of health insurance, an unwilling provider, or distress from the dissonance between one's anatomy and one's gender identity. And researchers urge institutions to increase their studies on the barriers transmasculine folks faced. In a Fenway Health study, both the patients and the providers said there was a lack of information about cervical cancer risk for transmasculine folks and the clinical practices needed. So I included some testimonies from the people that were in that study. Sam, a 25-year-old genderqueer and female to male identified participant, said, physically, we're not more at risk, but I think we are more at risk because we're not getting screened. And so I think that the rates are much higher because that prevention method is not there.
Celia, really quick. I don't know if you read, but the interpreter said just talk a little bit slower.
Okay, yes. Oh, I'm so sorry about that. Definitely do that. For another participant, several other participants expressed their uncertainty around gynecological issues. So Tyler, a 25-year-old transgender man, said, but I also don't know what causes cervical cancer. I don't know. It could be caused by toxic tampon chemicals, which most trans guys don't have to deal with anymore. I think these testimonies are also important because they talk about, bodily autonomy. And also in this study, they said that flexibility was the main, kind of like the best way that providers were able to really, have that trans-centered care. And so that included possibly allowing participants to give themselves their own pelvic exams, and really just, having that open dialogue with their patients, talking about, okay, like, what are your plans for the future? Do you want to have children? And these were really great ways for them to bridge that barrier that a lot of trans and gender diverse people face. So the study concluded that we need more trans-centered patient education to emphasize that trans masculine folks should have regular Pap tests. And then my last point is around the lack of representation. So reproductive health campaigns historically tend to idealize cisgender bodies when they only represent cisgender people in their advocacy campaigns. So this creates a very dangerous narrative that only those who can fit into the stereotypical cisgender body can access necessary and fair treatment, which is obviously should not be the case. And I included a quote by the National LGBTQ Task Force. So this is especially troubling given the disproportionate poverty, criminalization, and healthcare discrimination that trans, gender nonconforming, and intersex people face, making them less able to conform to this ideal, even if they wanted to. So I wanted to include this really beautiful graphic that shows that reproductive justice is for all people, all different shapes, sizes, and different identities, and how we really need to just break down what we think of when we think of building a family and becoming pregnant, because it's not confined to the traditional gender norms we think. And so I believe Lisa will talk about a couple of wins for reproductive justice.
Yeah, so this has been really heavy, obviously, because it's a heavy time. So I wanted to mention a little bit of some local organizing that has been happening. So in Orlando and St. Cloud, folks are continuing to organize protests demanding justice for Celidus Melvin. Really important to highlight this, especially Black Lives Matter protests have been continuing. They're still going on. One shut down my street 2 days ago. So if you are able to, please go join. I also wanted to say that those actions are usually hosted by Dream Defenders, the Orlando Dream Defenders, and I put the Instagram there, which is O-Town Squad with 2 Ds. So if you want more information on actions, they usually share those out. And I want to mention that workers of reproductive health and rights organizations are unionizing, and unionizing Workers' rights and workers' justice is a reproductive justice issue as well. So I think it's fantastic that they are fighting for better treatment of all staff, especially of Black and Brown workers who are often very dismissed at reproductive health and rights organizations. This is not to kind of turn people off from reproductive health and rights organizations. They do very important work, and they often work very well in conjunction with reproductive justice movements. But reproductive health and rights organizations tend to be predominantly white, and they tend to be very dismissive sometimes of Black and Brown bodies. So if you are in a reproductive health and rights organization and you are looking to unionize, I suggest you visit reprojobs.org. I am in an organization and we just had our union recognized, so it can be done. Unions are awesome. So if you are looking to unionize your nonprofit workplace as well, NPEIU represents nonprofits and you can contact them with information on that. If you are not a part of a nonprofit, you can visit joinifpte.org and they would be able to guide you along to whichever union is best to represent you, whichever union is best to guide you along this process of getting your rights as a worker. And then I want to mention Floridians for Reproductive Freedom. So when I talked about how reproductive health, rights, and justice organizations oftentimes do work alongside one another, especially when it comes to goals having to do with abortion access. The Floridians for Reproductive Freedom group, they are guiding young people who need abortion access and have to go through the judicial bypass system as a result of the forced parental consent bill that became a law. So you can visit this Florida Reproductive Freedom or FloridaReproFreedom.org website for some information on that. Next slide. And I also wanted to mention some reproductive justice organizations to donate to and follow. So in the beginning, I mentioned Sister Song. They're the very first and largest reproductive justice organization. And that is their Instagram if you would like to follow them and get some more information. So that's Sister Song _WOC. And then Florida Access Network is a local reproductive justice organization focused on granting access and giving money to people that need to have an abortion but cannot afford it. So their Instagram is at FL Access Network. Then want to mention Southern Birth Justice Network as well. So that is at Southern Birth Justice. New Voices for Reproductive Justice, mostly focus on uplifting a lot of younger reproductive justice voices. So that's at New Voices, number 4, RJ. And then Power U Center for Social Change, which is in Miami. So that is at Power U 305. So just some of the orgs to kind of follow their work if you want to get more in tune with reproductive justice.
All right, so this portion, it's really just the fact that you can gear any question pertaining to any of us. Any part of the presentation, if you felt that you had any questions, anything that you maybe wanted to contribute but felt like you couldn't do it at that very moment, anything that anyone wants to bring up, we can definitely address as well. And I do want to be able to thank Lisa for talking about all the different reproductive justice wins that she listed, and also all the different organizations that people should follow and donate to.
Oh, and I also want to mention that a lot of doulas have been fighting more for getting Medicaid funding for people to get Medicaid funding for doulas as well. So that is a good win all over the United States. So yes, go doulas, highly support them. And thank you to the interpreters.
Yeah.
Yes.
All right, so seeing as there's no questions at the moment, I do want to move on. There's more things in the slides that we're going to talk about. So the first thing, though, is that I want to be able to take a group photo with everyone. So if you do feel comfortable, you can turn on your webcam and we can all pose together. If you don't feel comfortable, that is completely fine. You can just keep your camera turned off. But to be able to do this, I will say, Ofelia, you will have to exit screen sharing, and then, okay. And then we're gonna go back to the presentation after this. Okay, let me go into grid view. All right, so I'm seeing there's 2 pages, so we're gonna be taking 2 photos. So I don't know who's a part of like what, but I'm going to say to like pose, and then just everyone, if you already feel comfortable with it, just pose in that moment. All right, so the first photo, we're all gonna pose, and then I'll let you know when I take the photo. And I'm gonna take it now. All right, that was the first one. And now on to the second page. All right, everybody pose. I'm gonna take it. All right, I've just done it. Thank you everyone so much for being part of the group photo. I'm so glad that we had a great turnout today. And if we could go back to the presentation just for a moment. All right, so we do very much want to be able to take in a lot of feedback that people have pertaining to our new Metamorphosis program. And if you feel like you have any suggestions into how we can improve a lot of the events that we have, maybe events that we haven't already done, or things that you feel like you would want to be able to see, definitely take our exit survey because your feedback does matter. And I'm going to be putting in the link for the exit survey within the chat, and this is very important, and please take it. If you feel like you don't have the time at the moment to do so, at least save it, and then being able to do it when you do have the time, because this helps us to be able to create a program of which, as intended, is affirming to trans, non-binary, gender non-conforming experiences, and being able to create informative stuff of which can actually positively influence our communities. All right, and the next thing that I wanted to bring up is, I don't know if many of you have noticed, but if you were able to hop on for the first Metamorphosis event, we did have an interactive portion for that one, and we didn't have it for this one, but it's also because for October, it's going to be a little bit more hands-on because we're gonna be having our first trans zine workshop. And in this workshop, it's going to be very exciting because we're going to be featuring an artist in the community, Shannon Hagan, and then being able to talk about the working class history of zine making and how it's affected many different subcultures such as the punk movement, and then also how trans people specifically have had a hand in making this medium, like being able to make information accessible for all and highlighting some of the work that has been done. And we'll even be able to have a portion in which people can learn how to make their own. And that'll be very exciting and very fun for like the month of October. So I'm going to put in the registration link. Our registration link in the rest of our social media is not up, but you all will be the first to be able to sign up for it. So if you're interested and you want to be a part of this workshop, very much encourage all of you to do so. And one of the last things I want to bring up is that we're starting a Facebook group for the Metamorphosis program. And this will be important to keep everybody in the loop with all the different events that we're planning, and just to be able to keep in touch with everyone, because we do want to be supportive of everybody's experiences. If you feel like there are things that you want to mention within the group, we're going to be very receptive to everything. And we want to be able to create as much interactions as we can, despite the fact that so much has had to happen through Zoom and largely remotely. So I put here also in the chat the link to the Metamorphosis Facebook group, and I probably will also email some of these links as well. And yeah, so that marks the end of this presentation. Remember, the Metamorphosis program is put on largely by QLatinx. We have all of our social media information here. If you haven't heard of us and would like to keep in touch with us and potentially contact us, it's all here. And thank you all so much for being a part of this. And I really want to thank the interpreters as well, because they're doing an awesome job, and it's obviously very much needed to be able to have language justice in all the events that we put on. So thank you all so much.
Thank you all.
Bye. Thank you all. Thank you. Bye.